Hello and welcome to MSRGN's Genetics Pop-Up. We are so glad that you are here. Thanks for joining us. We just want to start off with a statement from our funders. This program is supported by HRSA, and if you would like more information about them, you can go to hrsa.gov. Tonight, we're going to cover a topic called the top 5 questions families ask about genetic services. I am Christy Weiss, the projects manager for Mountain States Regional Genetics Network, and I am excited to talk with you about some of the questions we often hear from families about genetics and genetic services. So let's jump right in. Question 1 is, how do I know if my loved one may have a genetic condition? This is a great question because you don't know if you need genetic services if you don't know what to look for. And in the world of genetics, sometimes these what to look fors are called red flags, or symptoms or signs or things that might raise a red flag that something genetic might be going on. What is a red flag, you might ask? Some are listed here, but this is not an exhaustive list. But some things that you might see in a child or a young adult might be congenital eye defects or blindness, significant hearing loss or deafness, developmental delays, heart defects, abnormal physical features or abnormal skin findings, and then intellectual disabilities might be another red flag. There are many, many more, but these are just some of the top categories that might signal a sign that something genetic might be going on. If you'd like to get some more information about red flags, we are actually doing a survey right now, gathering red flags from parents who have gone on to have a genetic diagnosis. So you can find that survey by going to our website, mountainstatesgenetics.org, and typing in the search box red flags, and the survey should pop up in your search results. We'll talk a little bit more about other ways you can access this survey in a bit. Question number 2 that we are often asked about genetics is, how do I find a geneticist to see for my loved one, myself, or my child? So we highly recommend that you start with a conversation with your primary care physician or your child's pediatrician first. They should be able to provide guidance to you on a referral to a geneticist. However, if they're not able to help you, or if you feel like you need more assistance, we have on our website, mountainstatesgenetics.org, a Find a Clinic map. And for our 8-state region, this map will help you find the clinics that are nearby. Some clinics might be in-person clinics, some clinics might have the option for outreach clinics, and some might even be able to do telehealth or telegenetic consults. So if you scroll down to the bottom of our homepage, you'll find that Find a Clinic box there where the green arrow is pointing, and you can click there to see more. So moving on to question number 3, is genetic testing expensive? How can I get a genetic test paid for? So this is a great question because many people believe that genetic testing is outside the realm of affordability, but a lot has changed over just the last 10 years. The price has continued to drop for genetic testing, and so it might be quite a bit less expensive than you might have imagined in your mind. With that being said, insurance is often helpful, though, for covering these costs for families. Both private and public insurance do cover genetic testing, but each plan is slightly different. So the best way to start out is to contact your insurance provider. You can find the phone number on the back of your insurance card and just ask them about genetic testing coverage for your specific plan. You can also see a geneticist or genetic counselor, and their staff is very well versed at filing the proper insurance paperwork and providing additional documentation that may be requested and necessary to get a genetic test covered. Sometimes this additional paperwork is called letters of medical necessity, and those need to be provided by a geneticist or genetics counselor. And then also, last but not least, many of the labs that do the genetic testing have financial aid programs for any out-of-pocket costs that a family might experience. Some of them have programs that will cover this entire cost. Some of them have payment plans. And so that's also something else to explore. And question number 4. Why do I need genetic services for my loved one? How can it help them? This is a great question because some people wonder what they can really find out from genetic testing or from seeing a geneticist. I can tell you firsthand that knowing a genetic diagnosis can help a family find treatments. They can help them find support groups and support in their community. It can help you access services and resources that you might not have otherwise had access to. And it can give you comfort in having guidance to care for your loved one. As a resource for this, I wanted to mention a great organization called GARD. It stands for Genetic and Rare Disease Information Center, and it has a hotline number, a toll-free number, both in English and Spanish, which is open Monday through Friday from noon to 6 p.m. Eastern Time, that is staffed by genetic counselors that can actually give you more information and details on genetic conditions and rare diseases. So if you've recently gotten a diagnosis for your child or loved one and you want to learn more about that, or you want to connect with support groups or treatments or clinical trials, this is a great place to start. Their number is listed there, 1-888-205-2311. And this organization and service are free of charge. And last but not least, question number 5, how long does it take to get genetic testing results? This is a great question because many families wonder, is it going to be years before I know an answer, or is it going to be a few weeks? And the length of time can vary depending on the type of genetic testing offered. However, generally speaking, it's from weeks to about a month's time or a little bit longer. For example, one of the very popular genetic testing right now is called whole exome sequencing, or WES for short, WES for short. It can take up to about a month or so to get results. And the caveat here is if results are found. But the lab where your sample is being sent or your loved one's sample is being sent can absolutely give you an idea of what they call the turnaround time for results. Let's talk about that if results are found piece, because that one can be a little bit misleading for families as well. Oftentimes, families may have to undergo multiple rounds of genetic testing to receive a diagnosis. And this diagram here, though it has lots of boxes and it is quite busy, is really just meant to give an illustration and show that for whole exome sequencing, you can look at these 2 boxes here for cognition, for intellectual disability, or behavior for autism spectrum disorders. And let's zoom in a little bit. And you can see this percentage here in the circle. So for cognition or intellectual disability, about 42% of individuals or families that have undergone genetic testing for that symptom or that diagnosis have found a genetic cause through whole exome sequencing. And also for autism spectrum disorder, you can see that number here is 8.4% for families that have undergone that testing, whole exome sequencing for autism spectrum disorders. So you can see it varies. It's not 100% of every single person that gets genetic testing will find a genetic answer, but these boxes give a little bit of idea of some of the things seen in pediatric and childhood conditions that might have a genetic cause and lead to diagnosis. So last but not least, I just wanted to tell you who Mountain States Regional Genetics Network is and how we can help. So MSRGN stands for Mountain States Regional Genetics Network, and we are basically a network of 8 states. These 8 states are seen here from top to bottom: Montana, Wyoming, Nevada, Utah, Colorado, Arizona, New Mexico, and Texas. And we are a part of a larger regional genetic structure. You can see us in yellow here, but the whole country is covered by these different regions. And basically, we are all funded by HRSA, as I mentioned in the beginning, which is a federal organization. And we are funded to increase access and improve access to genetic services for individuals and families, specifically in our 8-state region, and specifically those who are underserved by genetic services currently. You can find us on Facebook and Twitter. Those are our handles there. So you can look us up there. But we are here to help you access genetic services. We are here to help you answer questions you have about genetic services. As I mentioned before, one of the things that you can take a look at is our red flags survey that's open right now. If you have a child that has a genetic diagnosis and you would like to share with us some of the red flags, some of the symptoms you noticed as a parent, we would love for you to take that survey. You can scan these codes here or just go to our website on our front page under the news tab and find the link. But we have it in English on the left there and Spanish on the right in the turquoise. I'll leave those up for a moment so you can get your smartphones out and scan those. And then something else I wanted to let you know about is our Genetic Navigator program. We are just getting this started, and so we have an application open right now. This is for families to help other families navigate the genetic system. So if you have figured this out for your child, if you've navigated genetic testing and you would like to help other families, we encourage you to apply. The due date is March 1st, 2021, and you can scan this QR code or again, go to our website, mountainstatesgenetics.org, and it can be found under the news tab, a link to this application. And last but not least, it is question and answer time. We want to open the floor to ask you what other genetic questions you have. We've gotten some of those questions from our registration, so we'll start off with some of those. But if you have other questions about genetics, we encourage you to type those into the chat box so that we can answer them live. Thank you for joining us today. And at the end of the pop-up, we're going to have a survey. And this is how you can get in contact with us and let us know that you would like to talk with us or our assistance. We have a question that we've added. If you would like some help navigating genetics, question number 11. If you are in need of some assistance with that, check yes to question number 11 and give us your contact information, and we will get back to you with more information and to find out how we can help. Thank you so much for attending, and let's open it up for live question and answer. And we want to provide a safe place for you to be able to get your questions answered about genetics. Thank you. Take care. Bye-bye.